Hello, I'm Bo Biggs and this is Kim Jernigan. We're the co-chairs for the Pensacola 2017 Mission of Mercy event. Welcome to Pensacola. Thank you for volunteering.
This is the signature event for the Florida Dental Association Foundation, and we are so excited to have you take part in this event. We plan to treat 2,000 patients in our community, and we'll do that because you're going to come and help us, and we're going to restore dignity and alleviate pain for many of the citizens of our community. Thank you for planning to be with us March 24th and 25th in Pensacola, Florida.
Plan to have a great time. It'll be a very rewarding time providing care for those in need, but I guarantee you will also have fun.
Go team!
Go!
Hello, I'm Oscar Menendez, Co-Clinical Director of the Pensacola Moms event. I'd like to thank you for volunteering and would like to go over some important information with you. I'm in charge of the clinical treatment areas and would like to go over the manner in which we have it set up. Before the event, you will receive different clinical protocols that are specific to where you volunteered. Please familiarize yourself with these and the site plan so you will know where you are going and what you are doing. The treatment clinic will be in Building 7 and consists of the following areas: oral surgery, restorative, prosthetics, endodontic, pedodontic, hygiene, sterilization, and supplies. The clinical lead for each section should have previously sent you the appropriate information for your section along with other important information that you should know before arriving. After you have checked in at volunteer registration, picked up your shirt and name tag, you will proceed to Building 7. Find your area and check in with your clinical lead who will be there. He will go over the pertinent information with you in respect to handling the equipment, clinical protocols, clinic safety, instrument handling and sterilization, the communication cards that are being used, and emergency procedures. Your lead is there to assist you, guide you, and try to make the event as pleasurable and rewarding for you as possible. That being said, please do follow your clinical lead's instructions. A lot of time and hard work went into them to make this a safe, productive, and rewarding event for you and others. Thank you very much.
Hello, I'm Dr. Tom Brown, and I'm the manager of the Endodontic department at this year's Missions of Mercy event in Pensacola. I'd like to start by thanking you for volunteering your time and your talents to help all the wonderful people that we're going to reach at this year's event. It's going to be great, like all the events we've had in the past, and I'm sure you'll really enjoy it at the end of the day. This video is designed to help review some of the protocols for our department so that you're familiar with that before our event. Please also look at your written protocols just to review in case there's anything I overlook. First of all, the teeth that we're going to be treating are anterior teeth only. Very select premolars if they're very straightforward and can be easily restored with composite, no molars. We're looking for teeth that we can make sure are going to hold up nicely with that composite restoration afterwards, since we don't have the ability to do crowns. So we'll be pretty selective in what we'll be able to treat. When you receive your patient, they should come with a registration form, review their medical history, any anesthetic that they may have already used from another procedure, if somebody's had a curious exposure or such like that that you would need to know about, administer any additional anesthesia that you would need, and proceed with treatment. We should have all the instrumentation that you would need to perform the procedures from start to finish, but if there's anything that you particularly like, any particular rotary files that you prefer, please feel free to bring those and we can sterilize and return anything you need that needs to come back to you. When you perform treatment, please remember to fully fill out the patient's encounter form with the dental codes and the tooth numbers that you have treated. Make sure you sign the form. Also remember the anesthetic that you've given. When you've completed treatment, you will escort the patient to the registration for our section and check out for our section. If they need a more complex composite restoration, in other words, just anything other than like an ideal access, something that might take you a bit of time to restore, they can be taken to restorative for that procedure. If it's a pretty straightforward, quick restoration of that access, go ahead and place that composite to help expedite the patient flow and allow us to see more people. But we also have the restorative department for that if we need it. Should a patient need any kind of medication prescription, which would be unlikely, we do not have an on-site pharmacy. Please let me know, and we can arrange to write a prescription that the patient will have to get filled at their own expense off-site. At your station, you will have some colored cards that will help communicate when you might need a patient. As example, it would be the green card. The red card would be to have an ambassador escort patient to the exit interview or to restorative. That'll be handled mostly by the people at the checkout, though. If you have any equipment concerns, there's a yellow card to signal somebody to come in. At your station, you will have the capability to take individual PAs as needed, intraoperative and postoperative. So that should be a pretty efficient process. In the event that you need an EMT, there's a white card with a red cross. If you need a translator, there's an orange card, and there's a purple card if you need an x-ray, but again, you should have your own sensor, and there should be no MAD units available, so that will be pretty straightforward. Again, thank you for your participation in this event, and if you've not participated before, you really are in for a great treat. This is a rewarding event, and everybody that participates has nothing but positive things to say about the event. Thank you.